Hey y'all, I wanted to film this video real quick because I talk about prescription pricing a lot. And so, have you ever walked into the pharmacy or walked up to the counter, gotten your prescription, and then heard them say, that'll be $100? And you think to yourself, well, it was $12 last month, so how is that the case? You're not crazy. You're not alone. Prescription drug pricing can be confusing, but there are ways to save money without skipping your medications because some people just skip the medication so that it lasts longer. So, what I want to talk about is some ways that you can save money on your prescriptions without skipping them or not taking them at all. And we'll get into it in this video. If you're new, my name is Takova. I'm a board certified ambulatory care pharmacist as well as a medical educator, and I want you all to feel confident and sure about what you're taking and how much you're paying for it and why. So, I'm going to talk about a few tips here. The first one is comparing things like GoodRx to your insurance. So, one of the biggest insider tips is that organizations like GoodRx can sometimes provide cheaper drug costs than your insurance. So there's GoodRx, but there are other sites like Single Care or WellRx that show you cash prices that are often lower than what your insurance would charge you for it. But there is a little bit of a catch here because you won't automatically get that price applied to your prescription. So you have to ask for it. And so you could go up to the counter and say, can you check the GoodRx price for me instead of running it through my insurance or before you run it through my insurance? Also, a pro tip if you do use something like GoodRx is that that cost might not and probably won't count towards your insurance deductible. So you really have to choose what matters most to you. Do you care about saving money in the short term, or are you bigger about long term tracking and meeting that deductible and saving money later? So, the next thing I want to talk about is just cash pricing in general. Whether or not you use something like GoodRx, many pharmacies themselves have lower cash prices for a lot of common medications. But again, they don't tell you unless you ask, and it's just almost impossible for pharmacists to run the cash price on every medication for every patient. So, when you go to pick up your prescription, you can say, hey, if I didn't use my insurance for this, what would the cash price be? Can you check the cash price for me? And this is going to be really helpful for medications that have, or excuse me, for individuals who have high deductible insurance plans or when your insurance doesn't cover the medication at all. So it's easier to do that when, a medication costs $300 and the cash price may be $150. So that's still helpful. The other thing, or the third thing, is that there are still generic drug plan lists out there. So the infamous $4 list from Walmart still exists, but other places like Kroger, HEB, Publix, it just depends on where you live. But they also offer $4 or near $4 like generics. So medications like lisinopril, metformin, amlodipine, levothyroxine, a lot of these really common medications, and the list goes on, but they're on the $4 generic list. And again, that company may not have exactly $4. It may be $3.99. It may be $5, but it'll be close to it. And that's going to be $4 for a 30-day supply or usually around $10 for a 90-day supply. And the pro tip is that you should ask your provider for a 90-day supplies, and that's going to help you save more money. And so for most medications, a 90-day supply is allowed. But after that time frame, they're probably going to want you to come in for more labs or something like that. So, or if it's a controlled medication, we may not be able to do that. The next thing is that manufacturers have coupons. So if you're on a brand name medication like Ozempic or Eliquis, you can always go to their website and check for a copay card. It can bring your monthly cost down significantly from, hundreds of dollars to somewhere between $0 to $25. But you have to have private insurance, so you can't have Medicare or Medicaid and take advantage of that. The fifth thing is patient assistance programs or PAPs. If you're uninsured or on a limited income, looking into patient assistance programs is going to be a good opportunity or option for you. These are things that are offered, again, by the drug companies to provide free medications for those who qualify. So you can go to places like needymeds.org or rxassist.org, or you can just ask a social worker or a clinic staff member, community health worker to help you with the paperwork. Some pharmacies, like at my hospital, we have a specific pharmacy tech within that pharmacy who works specifically on patient assistance programs for all the patients that go to that pharmacy or that qualify. Some other ways that you can just save and just think about, I already mentioned the 90-day supply, but also look into mail order pharmacy options. And listen, I want you to go in and talk to somebody. So don't look at mail order as a reason to not ask questions or to not be informed. Please ask your providers or ask your pharmacist questions. But sometimes that mail order option is more cost effective just to get the medication to your house. Also, you can join loyalty programs with pharmacies like CVS or Walgreens or wherever you go. And sometimes that can help with cost, or just using the same pharmacy and trying to streamline things can sometimes help compound and save you money in the long term. So, one thing I know for sure is that medications do not work for people who do not take them, or who cannot afford them. So, I want you to be your own advocate, ask questions, compare prices, and don't be afraid to look at tools like GoodRx. I do have a Ask Better Questions guide, and I'll link that in the description box below. I've turned it into kind of a card deck to make it fun, but if you don't ask the right questions, you won't get the right answers. And so it starts with asking really good questions. And also, I'm creating a medication savings guide. I'll also link that in the description box below. Again, completely free and something for you to consider looking into, to help you understand how you can save on your medications. With that in mind, hopefully you learned something from this. There's some way that you can work on saving on your medications in the future. And don't forget, if you learned something in this video, please give me a like just to let me know that this is something that resonated with you or that you appreciate it, and I'll continue to make content. Until then, thank you for watching. Have a good one.